Sky News. The full story first.
Coming up, a tsunami of superflu. The NHS warns that hospitals could soon be overwhelmed by a particularly virulent strain.
Hey, it's Sophie and Will from Sky News.
Too many headlines, too little time?
We get it, and that's why we're bringing you Cheat Sheet.
10 minutes every weekday morning.
All the big stories from politics to pop culture, minus the noise.
No doom scrolling, no spin, just the stories that matter from two people who live and breathe the news. Cheat Sheet with Ridge and Frost from Sky News.
Follow Cheat Sheet wherever you get your podcasts.
If you've been suffering from a particularly bad case of the pre-Christmas sniffles, believe me, you're certainly not alone. In fact, the latest data from the NHS shows that a new strain of influenza, the flu, is threatening to overwhelm our hospitals. Across England, the health service says there are enough flu patients to fill more than 3 entire hospital trusts. And there's no expectation the situation will get any better this side of the new year, all of which makes those doctors' strikes planned for a few days' time a major cause for concern. In the studio, we have Dr. Raj Arora, a GP and health educator. Great to have you on the podcast.
Thank you for having me.
And coming back, of course, our resident science expert, Thomas Moore. And we're going to start with you, Thomas. The data. How bad is it? I keep hearing about a tsunami of flu coming our way.
The Flu Tsunami, they're calling it, yeah. So we've had the latest stats from the NHS in England. There were an average of 2,660 patients a day in a hospital bed last week. That's a 55% rise on the week before. 106 patients in a critical care bed, so very seriously ill, and that's a 24% rise on the year before. And these are very, very seriously ill people who need critical care. So this is a really serious disease. It's not the common cold. This is influenza, very distinct virus. Let's just run through the figures from Scotland because we have an update on those too. So there's been a rise in the number of people in hospital from 860 to 986. So that's a 15% rise. So it is a slower rise in Scotland. Seems perhaps slowing down there, but we wouldn't make predictions based on just 1 week's data.
No, we certainly wouldn't. But Dr. Raj, it's been called a super flu. What does that actually mean? Tell me about this strain.
So look, the flu itself is not a nice thing to have. I can tell you that. I've had it once and it's, you've got it. You're very ill with it. But the super flu, I think, is indicating towards this strain that's mutated 7 times over. So it's drifted away from what we normally see for mutations. And mutations are obviously common when you have the flu. But I think because it's mutated quite a bit, it's rendered the vaccine slightly less effective than we would like it to be. So it's now at 30 to 40% for adults. For children, it's still at 70 to 75%. So it is still effective. It's just not a perfect match. And I think what we're seeing with the flu is that because that vaccine is not quite targeting that exact strain that's mutated, we're seeing those symptoms coming about and also causing more serious illness, especially in those that are more vulnerable. So the elderly, those with comorbidities, maybe pregnant people, and even the fit and well, because we're not quite capturing the same kind of immunity as we would from the vaccine.
You mentioned the symptoms there. I mean, how bad can it get?
So it's really clear to distinguish the common cold, I think, from the flu. Because as a doctor, as a GP, I do spend a lot of my time doing this. And I think the common cold is more gradual onset. So it's kind of like coughing, sneezing, upper congestion, you don't really get fevers or muscular aches or the other added symptoms. Also with influenza, there's a clear, sudden influx of symptoms, okay? And it comes on as a really high fever, for example. You will get aches and pains in the body. You may be getting a dry cough, a sore throat, a headache, feeling fatigued, loss of appetite, sometimes even tummy pain, diarrhea, vomiting, nausea. So it's a whole body illness. So what actually happens is you genuinely cannot get out of bed. You're really, you feel like you've been hit. And if you're somebody who's vulnerable, now already with a lung condition, for example, or immunocompromised, this can become serious. So the vaccine actually helps to prevent and reduce severe illness and hospitalisation. And that's why I think we rely on the vaccine for that.
And yet, Thomas, we are being told that there are parallels in our hospitals right now with what happened not that long ago in terms of COVID. I mean, how accurate is that? I mean, the scale is presumably vastly different.
Yeah, I mean, different viruses have spread in slightly different ways. And the R number, remember the R number? Okay, yeah. So, I mean, this is applicable to flu too, but the R number is slightly different.
For those who don't remember, remind us what that means, Tom.
Well, okay, so the R number is a measure of how easily these viruses spread from one person to another. So typically for seasonal flu, for every 100 people who get it, they'll spread it to another 120.
Right.
With this particular strain of flu that's going around at the moment, they spread it to 140. So that wall of immunity that we used to talk about in COVID, that's much lower this time round. Then people don't have that immunity built up from previous infections or from vaccination that will protect them against this strain. And that's why it's finding it easier to spread much earlier than normal in the season.
What do we understand then has been the impact on our hospitals?
It's bad, yeah. This time of year, it's extremely bad. And they are worried because it's all coming together at the same time, of course, as the potential 5-day strike from resident doctors, what we used to call junior doctors. And that is just before Christmas, when hospitals are really keen to get people home, to discharge them from those beds, because they want to give staff a break too. The number of people on shift over the Christmas period, they'd like to keep it much lower. And so they can't have too many people occupying beds.
Dr. Raj, we did, though, have a little bit of an early warning about this, didn't we? We saw what was happening in other parts of the world.
Yeah, so we saw in Australia what was happening over the summer. Obviously, their flu season precedes ours here in Europe and the UK. So I think it's really interesting to see what's happening there, what happened there. So they kind of peaked in June, July, I believe, but it wasn't with the same viral strain that we're seeing here, and that's important to recognise. But I think what's really important to distinguish as well is that they did have a peak in the summer months of their flu. They had record numbers hospitalised, they had record rise in influenza cases, but they also had lower vaccination rates, whereas we have had the same, if not more, vaccination rate here in the UK. So there was a slight difference there in what was happening.
What is the vaccine uptake in the UK at the moment? Can we put a figure on it?
It varies by group.
Yes.
So in the over 65s, it tends to be very, very good. So I'm looking at last week's flu report here from the UK Health Security Agency, updated every week. But the latest figures we have show that in the over 65s, 71% had the vaccine. In the under 65s, those with health conditions, long-term conditions like lung and heart disease and so on, it drops to 36%, 35% of pregnant women, and quite low in children, about 41% too. So in the uptake could be a lot better.
So I think what you're seeing is where that drops come down to 30 to 40% for adults is still effective in reducing severe illness and hospitalisation, but it will not be as effective as it was previously because of the mutations that the virus has gone through. And we were not expecting that to happen 7 times over with influenza, which has happened here.
As you will probably have experienced in your own practice, there is a degree of vaccine scepticism around these days. And I'm wondering, just when it comes to this particular vaccine, are there side effects? Are there dangers? What reassurance can you provide people?
So I think it's really important to recognise that if there's contraindications, you will be made aware of them. So it's a very, very in-depth form you'll go through.
Contraindication?
So meaning that you can't have the vaccine. But I think it's important to recognise that there's a really comprehensive form you go through before you have the vaccine. I think it's also important to recognise that normally for most people, the majority of people having the vaccine, the side effects are very minimal. I had mine yesterday and I had a really painful left arm. And, my arm was a little bit sore. I didn't have to take any pain relief for that. I was just aware that it had the vaccine. Some people may find they get a few symptoms, mild flu-like symptoms, but honestly, most of my patients and most people who have it don't really have any other symptoms of it. So that's really important to put out there. But yeah, other than that, it's quite well, received by most patients who have it and do take it. But what you mentioned about vaccine scepticism, I agree. I think since COVID, there has been a question mark around vaccines, and the flu vaccines has been there for years and years and taken up quite well. But I think there is also a little bit of fear around vaccines because of all that we've seen in the media and the public around COVID. So I think as healthcare professionals, we often have to have that conversation in clinic with patients and try to reassure them, because if you're in a vulnerable group, the best protection you can have really is through the vaccine.
Yeah, something like 1.5 billion people a year have the flu vaccine though, and it's broadly the same vaccine every year. It's just updated with a particular strain. So nobody should think that this is a new or experimental vaccine in any way. It is a slight update on the one that we had the year before.
And of course, if you have any questions about this sort of thing, go straight to your GP is always the best advice. But Thomas, are we at a point where if you can afford it, everyone should be getting the flu vaccine?
Yeah, I did. So I paid, whatever it was, 18 quid for mine. You make your own decision on whether you want to do it. But I just felt that I didn't want to ruin Christmas. Cases were building up. I could see that 3 weeks ago that we were heading for a crunch around a really important time of year when people tend to get together. Now, kids are the super spreaders of flu, right?
Tell me about it.
Exactly. All those snotty noses. So they pass it around the classroom really, really quickly. And we've seen that. Some schools have actually had to close temporarily because it's just, they can't actually staff it. It just goes around so quickly. The problem is that kids generally don't get that sick with flu, do they?
They bounce back quite quickly.
Yeah, it's Christmas time, when everybody gets together, they pass it on to elderly relatives, those who are more vulnerable, and that's when you see the big impact on the NHS. So the NHS will be extremely concerned that they could see admissions spiking at a time of year when people are off. And we're talking about 2,600 odd beds being filled at the moment. There are some predictions that could reach 5,000 to 8,000 by the end of this week, and that will continue rising. It's impossible to say where this is going to go next, but if you look at the trajectory at the moment, that steep upward curve, it doesn't look good.
So vaccination, all important, Dr. Raj. But the vaccine doesn't start working on day one, does it?
No, so it takes about 2 weeks to get to its level where it's going to give you some protection.
Have we still got time to sort this out before Christmas?
You have, yeah. Go now, right now. No.
Stop listening to the
Go
podcast.
right, yeah, go leave. And actually it's available, really easily accessible and available as well, the vaccines. You can go on the NHS website to get it. You can go to your local pharmacy to get it. You can pay for it if you're not in the eligibility criteria as well. And I think that's really important to say, because I think oftentimes you don't want to ruin Christmas, as Thomas said, but if you've ever had the flu before, you are much more likely, if you're not in the eligibility criteria, to go and pay for it, I think.
Yeah.
I think a lot of my patients come in and say, I'm not going through that again, and they go and buy it. So I think it's worth going through the eligibility criteria. So if you're 65 years or over, if you're between 2 to 11 years, you'll be offered it at school. If you've got previous health conditions or comorbidities, you might be in eligibility criteria as well. Pregnancy, if you're a carer and looking after somebody who's vulnerable, or if you're in close contact with a carer, or if you're a key worker. So those are all the eligibility criteria on the NHS. But outside of that, you can go and pay for it, as Thomas said.
I've had flu twice in my life, and it is utterly horrific. I could not get out of bed. It is so painful, just the muscle pains. It is just really, really horrible. Just trying to get out of bed to go to the loo, not good. And so people who tell you that they've had flu 4 times a year, that's not flu. It really isn't flu.
We've talked about vaccine scepticism. What about mask scepticism? This week we've seen the chief executive of NHS providers urging people, if they have some sort of symptoms, to pop a mask on if they're out in public. What do we make of that?
I think it's really important to recognise what mask it is that we're using. Every mask will provide some protection, I guess, because you're just preventing droplet infection from the influenza virus.
Essentially an aerosol coming out of your mouth when you cough, isn't
exactly.
it?
Yeah. But I think the masks that we're looking at, the really good quality sort of masks that we know work and have had some research and studies around them, are the FFP2 and the N95 masks, which give you more protection because they sort of block out respiratory droplets. They are fluid resistant, as it were. You're likely to get more protection from those masks. So if you are vulnerable and you want an extra layer of protection, you're thinking of using a mask, go for one that's going to maybe give you more protection than a bog standard surgical mask.
But is it for protection of yourself, or is it for protection of other people? Because I think even during COVID, people were confused as to why they were being told, mandated to wear these masks.
Yeah, no, I think you're right. I think if you want to protect yourself, you should try and wear those respirator-type masks with very high levels of protection. If you want to do the decent thing, even if you're getting over flu or even the cold or any respiratory infection this time of year, if you want to help other people on the bus or the tube, the train, wear those more surgical type face masks that we got used to during COVID, because it will reduce the distance that these virus droplets are able to spread, and that will help.
I think the idea is around that reducing transmission. It's not either or, you can protect yourself and the other person. But look, if a mask is not for you, and there are lots of questions around, well, masks might make patients feel like they are remembering the COVID era and they're worrying about that kind of connection or attachment. There are other things you can do: regular hand washing, disinfecting surfaces, ventilating your areas or rooms that you're in.
How about something more fundamental? Why isn't the advice, if you are ill, stay at home?
Yes, so staying, not being in close contact with others if you're ill.
Yeah.
And if you are coughing and sneezing into a tissue, into your elbow as a teacher at school, not openly on the tube or bus or wherever you are, because you are going to transmit. And like Thomas said, 1 person to 140, that's a lot.
So if you think you have the flu, what should you do?
You're just going to be tired, you're going to be bunged up, you're going to have this dry cough, muscle aches. You will be in bed, a day or 2 even, and sometimes 3 or 4, to be honest, depending on how bad you get it. But you'll be in bed, you'll be resting, sleeping. You might have a fever and it might be quite high, so you'll be, trying to get that fever to come down with medication. You can use things like paracetamol and ibuprofen if you're able to use those safely. Always check with your doctor, of course. But it is normally self-limiting, so it runs its course and then you're okay, But there are certain things you must look out for. And as doctors, we call those red flags. If you're struggling to breathe, if you're getting chest pain, if you're feeling dizzy, if you're passing out, if you are vomiting non-stop or aches and pains that are not getting better with any kind of pain relief or medication, bringing up copious amounts of sputum or blood in your sputum. So there are things that, you need to look out for. But generally, most people will feel rubbish for a day or two, and then it will start to feel a bit better. Keep your fluids up, keep hydrated, and try and eat small amounts. But you might feel that you've got lots of appetite, so it might not be.
Don't rush back to work.
Yes.
Well, that's
Don't give it to everybody else.
As if I ever do. As if I ever do, Thomas. But do we have an idea then, through the modelling or just through the kind of the educated guesswork that we sometimes see when it comes to public health matters? Do we know when we might be coming out of this?
No, you can't predict. We were talking earlier about Australia. Early on in the season, they had this H1N1 virus going around. That caused their peak in June, July. And it was only in August when you got this second wave of the H3N2, the subclade K virus that we talk about. It's very, very difficult to predict. At the moment, there's very low immunity against this virus, and so it will spread very, very quickly. It may be that Christmas in some ways puts the brake on the spread because the kids aren't at school, but it could change so that it's more vulnerable people who get the infection and end up going into hospital.
We've touched on it already, and it may well not happen. But of course, the doctor's strike is currently pending. Given all that we have been discussing, what are the possible effects of a resident doctor's strike across the NHS?
Having been a resident doctor myself, obviously, a while back, and I also through strikes as well, so I've lived that, so I know what it's like. I think it's really important to recognise that during strikes, when you look at the emergency departments, so the busier parts, they are always really well staffed for the strike. So, they get the bulk of the sort of attention, as they should, because you need to make sure that the A&Es are staffed. It's more what we mentioned earlier about the beds. So we need to move patients through the hospital, okay? So we need to free up beds. And I think if you've got people in beds because they can't be discharged, because normally the residents who are more junior residents will be helping with that. So they'll be discharging patients, moving them through the wards. And if that's not happening, you will see this impact of bed blocking, basically. So my worry is that could happen. But during strikes, weirdly enough, that is the time that the hospital is one of the safest places to be because it's really well staffed. So what happens is suddenly resources are pulled together. Suddenly you've got extra staff on shift. You have extra doctors, extra seniors on board. So it's one of the safest places during a strike. But of course, yes, it's not ideal. And I know, having been a resident doctor myself, that doctors don't want to strike. They don't want to be out on the picket line. They want to be in hospitals. And that's the most I will say about that, because I'm probably going to be slightly biased, aren't I?
No, I think you might. Thomas, you're not.
Look, I think every extra challenge for the NHS at this time of year isn't good. 90% of hospital beds are full. It's coughs and sneezes season. That is a problem. If you've got flu going round on top, that is an additional worry. So 90% of hospital beds full, 3% of those are down to flu. That's not the end of it. That could increase. So it is already a really tight squeeze on the availability of hospital beds, and they want to make sure that they've got capacity for emergency patients, obviously, but at the same time they want to discharge as many patients home for the holiday season as possible, because that's the way that hospitals work over bank holidays.
In the UK, in general, do we handle flu season well?
I think being on the front line and being a doctor, I feel like I'm also a health educator, so I spend a lot of time trying to talk about the prevention being key. We can be treated in hospital, we can have all the management, but actually where we want to be is trying to stop that from happening in the first place, reduce and slow transmission in those more vulnerable and elderly groups and in those with comorbidities and babies and pregnant women. So I think it's important that that's happening. And from where I am, I think that we do that quite well. So we do talk a lot about flu, we do cover it in the media. It's not something we shy away from. But I think it's a tough time because we've come out of this pandemic. And like I said, vaccination is a topic of discussion, even if a vaccine like influenza, which has been around, like you said, Thomas, for absolutely years, and there's nothing new about it, there's still that scepticism around it.
Yeah, I think scientifically they want to make a better way of making the vaccine. We've got this long lead time at the moment measured in months. During COVID, they were able to make a vaccine much more quickly, which meant that they could keep up with the evolution of the virus. Now, there have been great strides made at trying to make what they call a universal vaccine against flu. And that means that they're looking at totally different parts of the virus to trigger the immune system. And at the moment, they're not quite there, but they're making great strides. But we do need some way of dealing with flu, because you look back at the records, back to 1918, the Spanish flu, 250,000 people died in the UK alone. It's a huge number. We're nowhere near that this time round. The last epidemic we had in the UK was 1989, and then there were 26,000 deaths. So we need to remember that flu is a killer in some people, and that's why you hear from the NHS again and again, get your jab, because this is not a trivial disease for some people.
Certainly isn't. Thomas, Dr. Raj, great to have you on the podcast. Thanks both very much.
Thanks.
Thank you.
You can get all the flu advice you could need over on skynews.com. The NHS.uk website also has plenty of information as well. Thanks for listening. The Sky News Daily is back again tomorrow.
The world is on the brink. Wars, contentious elections, disinformation spreading at warp speed, and Donald Trump at the center of all of it. But what does it mean for the rest of us? Every week on Pod Save the World, Tommy Vitor and I cut through the noise to explain how global power is shifting. No jargon, no homework, just clear, honest conversations about what's happening and why it matters. From breaking news to long-simmering international conflicts, we dissect it all with critical analysis and some jokes that will surely embarrass our children one day. Tune in to Pod Save the World every Wednesday, wherever you get your podcasts, or catch it on YouTube.